Tēnā koutou, tēnā koutou, tēnā koutou katoa. Thank you and a warm welcome to the Oranga Tamariki Evidence Centre webinar today. It's fantastic to see many of you here today, all with a passion for understanding how we can contribute to supporting our greatest resource, our children and young people. For those of you who don't know me, I'm Vasanta Krishnan, the General Manager of the Evidence Centre for Oranga Tamariki, and I'll be hosting today's webinar. Today's seminar will have a focus on how international jurisdictions have supported children and young people and their families through this global pandemic, and will be presented to you by Sonia Sharp and Georgina Gates from Ernst & Young. Sonia is a partner in Ernst & Young's workforce advisory practice, as well as a national lead on public service workforce and COVID-19 response and recovery. Sonia has a wealth of experience in strategy development, performance improvement, organisational design and complex system change. Georgina is a director in Ernst & Young's workforce advisory practice. Georgina specialises in workforce and service system reform in human services and has worked across child and family services, child protection, family violence, mental health and disability. So without further ado, I welcome Sonia to lead us through this fascinating seminar.
Sorry, Sonia, you're on mute.
Sorry about that. I was on mute, the classic mistake of this time. Thank you, Vasanta, for that warm welcome. Tēnā koutou katoa, everybody, and I'd welcome, I'm delighted to be here. I also would like to pay my respects because I'm joining you today from the lands of the Wurundjeri people of the Kulin Nation, and I pay my respects to elders past, present and emerging, and including any Aboriginal and Torres Strait Islander people that join us today in the land. We're delighted to share with you the findings of our international review of approaches to keeping children safe and well during COVID-19. The key message is that we heard that everybody has struggled with this, and also that people have found very creative ways of trying to stay connected to families and communities, and to identify and notice early signals of harm or distress. So the scan that we conducted was focused on understanding international responses to COVID-19 for vulnerable children, and I'll talk a little bit in a minute about how we conducted that. I'm also establishing a community of interest, because everybody is working through new ways of working, different ways of working. There was a warm welcome to the opportunity to join with Oranga Tamariki to understand, share experience and foster open discussions, and we will share some of the insights that we gleaned from those conversations as well. We have the next slide. So we did a global scan. First of all, we looked around the world at everything that's happened, and then we looked in particular at 8 jurisdictions with varying experiences of COVID-19. So some jurisdictions that had been had many waves or were ahead in terms of waves. And then in depth into some of those. So we looked at New Zealand, New South Wales, Queensland and South Australia, Victoria. We looked at the UK, the US and Brazil. And as you see from the graph and from the figures here, with very significant variation and range in terms of the number of cases and the number of deaths experienced. Nevertheless, without exception, everybody struggled as they had to go into lockdown and close down services and restrict contact. Next slide, please. So in summary, we found that COVID-19 brought similar challenges to nearly everybody. There was reduced oversight of children and young people. There was increasingly complex community needs, from needing food, struggling for some families, struggling with shelter, increased incidents of family violence and stress within the home. There was a strain on service providers, and certainly there were budget pressures. But what we also saw was a very rapid response and a creative response around the care and protection of children and young people, leveraging local networks and community leaders, shifting quickly to online service delivery with use of telephones and smartphones being at the centre of that, creative grassroots practices to proactively support children and families. And I'll pass over to Georgie in a minute, and you'll hear about some creative examples of those, for example, through welcome packs of food and stronger community connectivity, and also the rapid upskilling of staff. So in a matter of a few days, in most jurisdictions, whole workforces had to shift their practices to move to a way of working that they were simply not familiar with, and they did it remarkably well. In youth justice, we saw a move to greater digital approaches to justice settings and to keeping connected to young people, court appearances, and we also saw a health imperative to close facilities quickly. Sometimes that was closing to family visiting, and other times children were supported in their home and community with higher vigilance, and in particular a real emphasis on communication and engagement with families. Intelligence and data approaches, from data reporting and demand forecasting to data modelling. We saw some really smart use of linked data sets as a way of identifying early signs of family distress, and we also saw some really good examples of cross-government collaboration and soft intelligence to enrich data sets. And we also saw some interesting practices around culturally appropriate responses, with a big emphasis on inclusive and community-led approaches, leveraging community networks and local leaders, cultural leaders, community leaders and faith leaders. And also we saw there some varied responses across urban, regional and remote communities. And again, as I hand over to Georgie, we'll give you some practical examples of what those are. 5 key themes emerge, so in terms of the important features of these responses. First of all, we heard nearly everywhere the key role of the school and in providing care and advocacy, and sometimes food and shelter and warmth. Those places that kept their schools open were an absolute cornerstone for children and young people. We saw increasing use over time of schools, with more children and young people attending, and we also saw them as a contact point for care providers, services, and those children and young people. Connected to that, we saw the importance of community relationships, as I've already mentioned. We saw the importance of communication and campaigns, getting information out to children, young people directly, and families, tailored for children, young people and culturally diverse groups. We did see the importance of face-to-face contact for the most at-risk groups, and whether that was through doorstep visiting, whether that was through the school, whether that was through community connection, nevertheless, there was still some need for face-to-face contact. And also we saw the importance in linking local government with cross-system data sets to enrich the view of families and young people. So that local network of local government combined with state governments and all services to come together in a collaborative way to work effectively to support each other to keep children safe and well. Next slide. In terms of some of the challenges that we saw, we saw that the impacts around the world have been very, very significant. So 22 countries globally have reported a 50 to 100% drop in children and families' access to child welfare authorities during COVID-19. So we saw a significant drop off in connection to formal services. We also saw a 50 to 100% drop in violence prevention programs, such as parenting campaigns, online child safety campaigns, We also saw, again, similar numbers of countries, a 50 to 100% drop in case management services and referral pathways. So generally a picture of a reduction of use in formal services. We also, however, that was matched by an increase in reports of family violence and informal connections. So there were challenges, but the formal processes were not necessarily being used. And in particular, 368.5 million children across 143 countries who normally rely on school meals for a reliable source of daily nutrition were having to look for other sources. And again, in those countries that kept their schools open for vulnerable children, what we did hear anecdotally were examples of how children and young people were coming to school because they were hungry. Next slide. Here I'm going to summarise just the kind of like the top 10 challenges that what emerged from the interviews that we took. Increased community demand. So there would, although there was a drop in formal use of services, there definitely was an increase in demand. There were increased risks to already vulnerable cohorts, and particularly what we saw almost globally and without exception was an increase in reports of family violence to police. Continuity of workforce and care, and as particular workforces in for particular communities or geographies or cohorts were affected themselves by the virus, then strain on services. And we also saw some really creative teaming approaches across providers to support each other during those challenging times. We saw an increased impact on custodial settings as highly vulnerable communities for the spread of virus, with immediate concerns about the health and well-being of young people in custodial settings and challenges to maintaining social distancing within those contexts. We saw the importance of data sharing coming to the fore, and where services or jurisdictions have limited opportunities to data share and to link data sets, they were challenged, whereas where there was established practices for data sharing, it was easier to see early signs and signals of distress where those were used widely. We saw that where there were not strong relationships between agencies, that also created challenges in terms of soft intelligence, but also the creation of contingency workforces. Next slide, please. We saw the challenges of a lack of oversight, and that services had to be very creative about how they maintain contact with families during this period. We saw budget pressures. We saw an increase in the use of virtual interactions, so nearly every jurisdiction we spoke to had moved online in some way, moving to online social services, including court hearings, but we also heard of digital inequity. So say, for example, here in Victoria in schooling, the Department of Education and Training had to provide 65,000 laptops to over in a 10-day period to children and young people to enable them to maintain contact, and also connectivity, challenges in connectivity. So where there's less effective broadband, that also meant that there was digital inequity, and this situation just brought that to the fore. We saw delays in court assessments, and leading to heightened instability and a backlog to address the recovery phase. We saw a lag in data collection and also a lack of visibility on future needs. So those families that were known to services were able to maintain connection of some sort, whereas there was definitely anxiety and concern about those families who became vulnerable, who may not appear or may not be noticed until the lockdown restrictions had been reduced and ways of living and learning and caring moved back to a more normal rhythm and cadence. I'm going to hand over to Georgie now, who's going to take us through some of the solutions we saw. And I must say, hats off to the ingenuity of our child protection colleagues and colleagues who work in child and family services, because I think you'll agree that there were some really creative ways of responding to these challenges.
Tēnā koutou katoa. Good morning, everyone. I'm Georgie Gates, and I join you today from the Bunurong People's Nation in Victoria. And I would also like to pay my respects to elders past, present and emerging, and any Aboriginal and Torres Strait Islander and people here today across our communities. Thank you again for having us today. So I will take you through some of our findings from our research, and we really do, we really did find that there was some very strong themes. And whilst the experiences of many of the jurisdictions that we interviewed and researched were quite different in terms of the trajectory of the pandemic and the sort of variable impacts on the community, we did very much find that there were some strong themes in the way that they had responded to support children and young people and adapt the way that youth justice services were provided to better deliver that in the context. So the first thing I'll speak about is some of our findings when it comes to the care and protection of children and young people. And as Sonia outlined, we interviewed a range of jurisdictions and researched a range of practices that were in place. And we found here a range of really, I suppose, adaptable practices, both in terms of the way that service providers shifted to be able to take up some very practical strategies for engaging and maintaining contact with children and young people, the way in which that quite innovative practices and rapid change occurred, particularly in the transition to new technologies as well, and then also a range of new workforce models that were brought in, both in terms of the direct social workers and practitioners working with children and families, but also the way that services collaborated together. So firstly, we very much saw that there were quite significant adjustments to service delivery mechanisms so that in order to minimise risk of infection and protect families and children and young people, in many cases, services adapted to restrict and limit face-to-face contact where necessary. And there were some really good examples of the way in which that was undertaken. So in some jurisdictions, they took a very risk-based approach where they put in place a range of options to be able to consider the degree of risk around a particular family and the extent of need, and identify whether that family still really genuinely did need a face-to-face home visit, or whether that engagement could still occur through virtual means. And in actual fact, there were a range of approaches that were really effectively delivered to maintain that, and some really creative strategies to do that in a practical way. So, for example, we found in South Australia that they put in place so a range of approaches to engage with families directly through the provision of food relief and really well packaged hampers, both in terms of food and hygiene products and so forth, and would deliver those to the home as a way of maintaining contact and assisting the family both in terms of maintaining contact with that child or young person, but also providing them with practical support. We also saw that extended to the provision of food vouchers and other other forms of relief, which would either be delivered to the home or through a local centre, which would encourage that family to collect it in a contactless way, but still allowed some contact to ensure that the family was coping okay through these times. As I think many of you will have experienced, there was a very rapid shift to new technologies to enable virtual service provision, and we've heard about some really innovative approaches in the way in which families have adapted to that, and the way in which practitioners have really shifted their ways of working to be entirely virtual. So we did find that there were some quite effective approaches, whether that be through the use of Zoom or Teams or other platforms, to conduct virtual check-ins with families, or even family group conferencing and other activities that could all be done virtually. In Victoria, we had families' home visits being conducted virtually as well, and service providers were really reporting that was, nearly as effective as being in the home and seeing the home in the flesh and getting a sense of the family's activities. I think the other feedback that we heard quite consistently was that was actually much more flexible for families and could be better tailored to times of day that suited their needs, and also allowed some more frequent contact as well, particularly for young people who received the virtual forms of engagement really effectively. So we heard in the UK that young people had really adapted to virtual engagement and were much more likely to respond to a FaceTime or other form of connection, rather than requiring them to attend a session at a particular time and location, and it allowed them to also feel supported in a much more tangible way. The other thing that I think was really interesting in the US was around the use of places of trust, and we saw this in many jurisdictions. We also know that this has been really applied in New Zealand as well, across your communities. But in the US particularly, places of trust such as churches or community centres, and in many cases for a range of diverse communities, were leveraged to maintain contact with families. And in these cases, these places of trust were able to connect with families when other essential services may have been closed, when there are a limited range of options in terms of where you could go during periods of lockdown. And care and protection agencies were able to leverage these as part of their broader network to facilitate that connection with families, and work with those community organisations to understand understand the kind of health and wellbeing of that family, and also be able to monitor risk as well. I think one of the things that has been most remarkable has been what we've seen in terms of the way that different workforces have adapted to the change. And I'd just like to speak a little bit about some of the changes that we've seen and found through our research. And so I think the first thing to note is that across many jurisdictions, there was a need to very rapidly train and upskill practitioners to adapt not only to new ways of working, but also the use of virtual technology. And if you think about it, many of our organisations, government and non-government service providers, often the prospect of digital change is a very long journey, but what we've seen quite consistently is a very rapid transition to a digital way of working, and although we know that of course that doesn't suit every situation, and there are many cases where there is a critical need to go and visit the home in person or have that face-to-face contact. in many ways, as I've mentioned, the virtual forms of service delivery were very readily put in place, and I think it's a strong credit to the practitioners and social workers and team leaders and managers that was able to be undertaken. The service delivery arrangements as well is definitely of interest. We certainly saw a range of strategies that were put in place in quite creatively thinking about workforce models that could better service need throughout this time. And that was from a range of perspectives. It was both in terms of making sure that there was sufficient workforce available if in the event that the workforce itself was impacted by the COVID-19, and so from a workforce contingency perspective, we saw a range of initiatives to bolster the workforce. So, for example, in the UK, they instituted a program called Social Work Together, and through this program, they brought recently retired social workers or social workers whose registration had lapsed back into practice, and to provide a contingency workforce that could be drawn on to bolster and support care and protection services. Similarly, we also saw some creative approaches to use of volunteers throughout this time, and in many cases, or partly indirectly due to the economic environment, there were some jurisdictions who found that volunteers were quite there were quite a willing coalition of volunteers who were keen to support and be available, and we saw that very much in the UK, the US, and some of the Australian jurisdictions where a volunteer workforce was enlisted to support the delivery of food hampers and the provision of practical supports and other assistance that helped to kind of monitor risk, but also most importantly maintain support and contact for families. The other thing that I think was of quite innovative, and we heard this quite consistently, that there really was a lot of local innovation in the way that service providers work together, and also some structural innovation in the way that services were working together. And so, for example, in South Australia, we saw some reorganisation of frontline staff in order to better meet the community's needs, and also to protect workers that might have been more at risk from an infection perspective, using a sort of A and B team type model to cater to different needs and also make sure that that the workforce was better equipped to work through this most challenging times. But in Victoria, we also saw an innovative approach where a COVID-19 response team model was put in place, which was a multi-agency team, and in local areas, a combination of statutory child protection workers with service providers and frontline social workers were brought together to provide both a really targeted wraparound approach for families and children most at risk, but also to provide a bolstered contingency in the event that any one service provider suffered an impact in terms of the workforce, and that really assisted to support workforce service continuity. We might go to the next slide. Thank you. From a youth justice perspective, there were also a range of interesting approaches that were put in place. I think the first thing that we saw consistently in the youth justice setting was an immediate response to minimise risk and to lock down facilities and from a custodial perspective, and also to really put in place some strong workforce contingency practices to ensure that that custodial facilities would be able to maintain operations and support the safety and well-being of the young people within their care. But particularly of note as well was the way in which youth justice services also adapted to virtual service delivery. And that was both from the perspective of the young people within custodial settings, but also the way in which young people in the community as part of the youth justice system were supported to maintain contact. And also the way in which that allowed that strengthened engagement with their youth justice worker and that support throughout this time. So in a number of jurisdictions, we saw the provision of devices and laptops to young people who were either in custodial settings or in the community. And this both served a range of purposes. It allowed those young people to maintain their learning. It also provided them with sources of entertainment where those sorts of things were limited due to lockdown arrangements, and it allowed them to have virtual means of maintaining contact with their families, which was really well received in a lockdown scenario. In terms of the young people in the community. In these cases, there was a much more strengthened approach to engaging with those young people, and from a youth justice perspective, once again, there was some excellent feedback on the way in which young people had received the virtual forms of contact, and actually quite a positive response. Again, so from the UK perspective, for example, they felt strongly that young people within the community as part of the youth justice system had very positively received the virtual forms of contact and found it very flexible, were much more likely to engage and also much better supported in a more regular and flexible way. I think the other thing of really strong note was around the way in which there was quite proactive outreach in some cases from a youth justice perspective, and we saw in Queensland a really strong approach to working with community organisations to connect with young people and their families in the community, both in terms of supporting that family unit and ensuring they had the practical supports they needed through a very difficult time, but also to support from a behaviour perspective that young person and assist to maintain a focus on diversion and those sorts of things. The other aspect that I think was quite significant from a youth justice perspective was the focus on the use of data and a strong approach to governance in monitoring the kind of the operation of the system and the safety and well-being of young people. So there was some quite effective approaches that we saw to the use of monitoring and data and analytics to both monitor a range of indicators about the safety of and operations of a custodial setting, but also from a court perspective to really monitor the impacts of the lockdown and disruptions to court processes. To get on top of that and ensure that that there weren't adverse impacts. There were in many jurisdictions adverse impacts as a result of lockdown and slowdown of court processes and the shift to virtual courts was undertaken in many cases, but conversely, in many cases, court processes had been put on hold, impacting some young people and their families. We might move to the next slide again. Thank you. Okay, another area that we looked into as part of our research was also to really understand how jurisdictions had responded from the perspective of a much more tailored approach to specific communities. And within this, we looked at both Indigenous communities and across different jurisdictions, but also in terms of migrant communities. And we found some variable approaches, but also some really interesting innovations and community-led approaches as well. So from the perspective of Indigenous communities, and we looked at this across a range of the jurisdictions that we researched. We did find that very much a very strong focus on self-determination and self-determined and community-led responses was quite critical here. And in many cases, we saw very good examples of community-led organisations and community leaders stepping forward to play a very active role in both determining the way in which their community would respond to the pandemic, but also in terms of supporting and enabling the families and children and young people within their community. So I guess what did that look like in practice? So for example, we saw that the Victorian Aboriginal Community Controlled Community Care Agency took a very strong approach to the way in which they supported Aboriginal children and young people during that time. And in this context, it was both urban and regional and remote regional communities. And through that, put in place both a range of practices in the way in which families would be consistently supported throughout this period, but also the very tailored communications and engagement with the community to promote effective practices in terms of health and well-being and prevention from an infection perspective as well. There were some quite different approaches from a communications perspective, and we saw some jurisdictions take a very proactive approach, and when it came to tailoring communications to different language groups, to different communities. So, for example, across Australia, there's been a Deadly campaign, deadly being a very a sort of colloquial word when it comes to the Aboriginal community across Australia, in terms of how to prevent infection and how to support your family and community through a time of lockdown. And similarly, we saw really strong practices across New Zealand as well in the way that your communities stepped forward to lead a really collaborative response and have some very tailored approaches to the way that communities were supported to understand and raise awareness of the pandemic, the impact that might have, and also the supports available. I think we did really see as well some quite strong advocacy from community leaders in really making a stand on what was needed to best support their community, and working with governments and other agencies to provide those supports, whether they be practical supports that were needed, and also the types of safeguards that were needed. So a very strong approach to locking down communities where necessary, particularly in remote locations, to minimise access and risk of transmission, and working with other agencies to ensure a strong supply and support for other essential services throughout that in a safe and effective way. When it comes to migrant communities, I have to say that the range of supports available were more variable. There were a range of approaches here which range from a very strong approach to supporting migrant communities through to much more variability, and often it was very much impacted by the extent to which those specific communities were the types of visa arrangements and other things that were available to those communities. We did see though that there were a range of financial and in-kind supports that were made available to migrant communities being very much impacted by not only the kind of impact on them as a family and often not being able to contact and or visit family members overseas, being impacted in terms of their ability to work or perhaps the range of employment options available or lack of employment throughout this time. And also, as I mentioned, the range of visa arrangements that also impacted their access to support. So some of the things that we did see, and these varied across jurisdictions, but we saw, relief and assurance for temporary visa arrangements, so enabling people to continue on temporary visa arrangements if they were likely to expire or unable to actually travel. Emergency funds for international students and options for them in terms of being able to remain within the country and access supports, being able to access their pension or superannuation products at an earlier point to have some funds available, increasing the availability of hours that could be worked under certain visa classes, and also a range of supports from a seasonal worker perspective. But we do recognise, I think, that in many countries there was a strong, I suppose, theme of limited supports from certain migrant groups. That we did though see that there were, as the pandemic progressed, there were perhaps a stronger focus on a provision of communications and targeted engagement for migrant communities in a range of languages and tailored to different literacy levels as well, and innovation in the way that they were used both through a range of channels, whether that be around flyers and posters in certain locations, the use of the web and social media, and also leveraging community networks to promote really key messages from a health protection perspective, but also in terms of the supports available for families and children and young people during this time, when in many cases migrant communities may struggle with access to critical services, and also may struggle in terms of understanding the or having the accurate information in their language, or in a trusted way to understand how they can best navigate through this time. But I think we did see some very strong advocacy from community organisations and community leaders across migrant communities, and that that was both in terms of supporting and raising awareness across their community, both in terms of the nature of the pandemic and the way in which they could keep themselves and their families safe, but also helping those communities shift to virtual forms of contact and replacing religious and cultural gatherings with virtual forms of contact, and also really proactive door stopping and outreach for families who have particular vulnerabilities or were known to be at risk, and working very closely with care and protection agencies to support those families as well. We might move on to the next page, thanks. So I think one thing that we did see that was particularly, I suppose, creative and innovative was very much around the way in which many jurisdictions quite rapidly stood up or leveraged existing functions that really supported them to understand what was going on with the children and young people within their care, or known to be at risk during this time. And this took a range of forms, but in many cases we saw that agencies very quickly stood up options to monitor a range of indicators to understand and monitor risk and need, and be able to have a more accurate view of demand for services. And that was both at a national level and a sub-national or state level, and also at a local level. I think in doing that as well, we found that that there was a range of quite great practices in the way that kind of national level and state level bodies then collaborated with practitioners on the ground and local service providers to gather genuine soft intelligence about what was going on with the families and communities within known to them and within their local area. And that allowed a very strong two-way connection, so that not only were the indicators being monitored, but also that they were drawing on the actual on the ground knowledge and innovations in terms of the way that those communities were being supported, and the innovative practices that social workers and practitioners were applying to maintain contact and have a more true understanding of the kind of risk and need and vulnerability across different family groups. But some of the indicators that I think were typically used were very much around, both from reports of concern and notifications to child protection. They also leverage data on domestic and family violence, visits to accident and emergency, known other risk factors such as mental health and disability, drug and alcohol use or offending, as well as known chronic health conditions and other vulnerabilities to infection. And we then also saw the use of pulse surveys of practitioners and caregivers, as well as staff, to identify needs and understand impacts. And we know that in New Zealand that there was some really effective ways to gather that intel through surveys as well. And also in the UK that there was some very sort of systematic ways put in place to gather that on the ground intelligence and bring that up to a national level. For example, I think one example of this that was quite effective was in South Australia, where they put in place a vulnerable persons board, which allowed them to monitor the impact of the pandemic on children at risk and their families. And they drew on a range of those data sources that I mentioned, but also a range of more real-time data sources as well, to kind of on a weekly basis assess risk and need and be able to understand where they might need to target their efforts. Similarly, in the UK, we saw the National Vulnerable Children's Board come together in a much more frequent way. I think previously it had been a monthly board that reviewed lag indicators. Throughout the pandemic, that board then was elevated up to a weekly and bi-weekly activity, which then brought together a range of national data that drew on that local intelligence up to the national level to maintain overall visibility of at-risk families and young people, and worked much more closely with local government and local practitioners to gather those insights. And then I think from a custodial perspective, there were also, as I mentioned before, a range of those effective approaches put in place, which paired with really strong governance allowed for very proactive monitoring. I think one thing we did see though that was most interesting here in certain local authorities in the UK was the use of predictive analytics, and we also saw this in Brazil as well, where not only were they drawing on sort of known and typical indicators of family risk and need, but also used a range of indicators about financial stress, unemployment, and other factors to be able to gauge, when they might expect a family to come into future distress. And this allowed a very targeted approach at a family level, and to be able to say, well, we might expect that this family is at risk of homelessness even in 8 weeks' time, and we need to target some very proactive supports here, or it's likely that as this family is known to child protection, these additional indicators are telling us that we need to provide some much more targeted supports. Okay, next slide, please. Okay, and I'll just turn back to Sonia now to talk through some of the final reflections and insights that we heard from our network of jurisdictions that came together to share their experiences through a community of interest.
Thanks, Georgie. I think one of the really compelling insights that came out of the community of interest was that very much people are located in the now, responding to the immediate challenges and pressures of the pandemic response, rather than shifting to the perspectives of what's next and what might lie beyond, and certainly not thinking yet of evaluation and how they might be able to gauge impact. So just to summarise then, through the community of interest, we heard that no matter where people were in the trajectory of the pandemic for them, and of course we had people who were going through maybe their second or third wave, as well as those people who were just experiencing the early days of the viral spread. Despite that difference in trajectory, the journey was so similar around the world, with very similar experiences, similar responses to proactively support children and family, and similar concerns. Again, the kind of remarkable agility of the services in government, service providers, community and practitioners across the care and protection ecosystem, with people rapidly mobilising and developing innovative and creative and very virtual ways of staying connected, and had transitioned to virtual service delivery really effectively, with plenty of examples, as you've heard from Georgie, of local innovation. There was a trend in reduction of reports, and definitely genuine concerns about increases in other forms of family risk and hidden impacts, particularly thinking about babies and young people who are nearing adulthood, at some of those core cohorts seen as at greater risk of not being noticed or not being connected with. And we also heard as well of concerns around families where there was family violence in the home, with everybody being at home, how hard it was for adults, for mothers or parents experiencing harm themselves and their children, to actually make contact safely. There was a major concern that second waves and the post-pandemic impacts are yet to come, and a sense that there would be an increase, a further increase in demand and impact becoming more visible over time. A sense that we haven't seen the real impacts of this pandemic yet. We will only become aware of them in the longer term rather than in the now, and that there were signs of financial stress, mental health and other impacts that again would continue to merge. In youth justice, as you've heard, a strong and swift response with integrated governance had worked well. And also what we heard this in youth justice, and we also heard this in care and protection, that the move to virtual approaches to connection had actually worked better for some families and increased and improved connectivity. And similar signs of strengthened engagement with families, community service providers and strong governance, and a place-based, local-based, drawing on all of the resources of local communities, including the usual suspects, but also those who might be a little bit unusual, came to the fore. And finally, and for you as a community of people who are deeply connected to evaluation. Lessons learned will be critical to future preparedness, but as I mentioned, what we definitely heard from the community of interest is a recognition that most jurisdictions are only at the very early stages of considering lessons learned. In fact, what we saw was in New Zealand, you're ahead of that trajectory, because you're thinking deeply already about what difference does this make, how can we differentiate between the impact and effectiveness of different strategies, what do we need to do to prepare better for the future. Many jurisdictions are simply not there yet. They are just coping with the day-to-day, managing the pandemic response and not yet progressing to that important evaluation. Final slide. What we also heard from the community of interests were, and also the scan, were there's some key questions that lie ahead for us to explore. Understanding what changes and responses delivered greatest impact for children and young people. What changes will be retained going forward, and what changes present opportunities for future evolution and transformation. And certainly we're working with a lot of organisations at the moment who are just taking breath and beginning to think about the transformational shifts they want to make going forward. What have they learned that works better and differently? So telecare being an example of that. And what are the things that they haven't tried but would like to try going forward? What are the most significant challenges, and how can these be overcome in the future, particularly because we become aware that the impact of the pandemic is likely to be with us for some time in the future. Most predictions are a minimum of the next 12 to 18 months until some form of vaccination or long-term management strategies can be firmly embedded. So this is with us, these challenges are with us, and some of them we don't yet know. And then fourthly, what are the key lessons learned that inform preparations for future pandemic events? Because we know that we are likely to experience similar challenges. If not this pandemic, it'll be COVID-20 or 22 or 30. So let's capture that learning and prepare ourselves well. I'll pause there, and we'll open for questions and discussion. Now we've got a Q&A function in the Teams live event. So if you look to the, there's a box on the right hand side with a little question mark in it, then feel free to add comments, share your own observations and experiences, and open the conversation. We'll pause a couple of minutes to allow you to add your comments. While we wait for Santa, I might just ask you a question. You've commissioned this work and have been engaged all the way through. What are the key lessons that emerge for you that you think are the most pertinent and relevant that people need to be thinking about?
I think, given that this has been a global event and none of us have been immune from it, there's a real opportunity here for us to learn from each other. So if there's a silver lining in this tragedy, it is that, the ability to learn from each other, because we are all in real time to varying degrees experiencing this same event. And so I think we need to continue to kind of do that as we go forward. I think the other things that really stand out for me is just the, when we needed it, the ability of both the government systems and the communities, and the resilience of the communities kind of to step up and do what was required to kind of manage us through it, has come through really strongly, not only in New Zealand but in other jurisdictions. And you know, when you think it's not there, it actually is when it needs to be, and that's really reassuring to see that come through so strongly. I think the other thing that you cannot get past is just the nimbleness and the ability of people to adapt technologically. You cannot kind of get past that. People who, and organisations that wouldn't have thought that they were prepared, but actually showed that they were when it came to it. And I think, and how we go forward with that and how we continue to build on that, I think is going to be a really, really important lesson. I think, you know, the final thing for me is just the resilience of people that comes to the fore, the resilience of communities to come up with solutions to look after their own communities has been a real lesson. And one of the things for us going forward is how do we work better in that space, and how do we bring forward, you know, initiatives that are about prevention, early intervention, and make the most of that and through what we've learnt in this exercise.
Thank you for Santa, and I do agree with you. The resilience and agility of the service providers has been extraordinary, and also that agility of government. Having worked in government myself for many years, we don't always appear as a nimble beast, but we certainly I think governments around the world have really shown what they can do and how fast they can move when required. One of the interesting trends that I know questions I've heard is, you know, have we recreated an over-dependence, and how do we shift back from there? So I'm going to reach out to people in the audience to just give us your ideas and insights into, particularly thinking about it from an evaluative perspective. You know, what are you thinking that we should be looking at next? What are the questions that you see that we should be asking?
Sonia, we've had a question in from Julia, and Julia's saying that, you know, many in the UK, which I think is where she's from, many social workers are struggling with their own situation at home and having to kind of manage work and family in the context of COVID, and trying to keep contact with their service users. So her question is, you know, are social workers in these parts of the world also finding it difficult, and are they receiving the support they need to continue to do their job well? Thanks,
Georgie, and thanks, Julia, and thanks for joining us from the UK. That's fantastic. So it's really interesting. So what we've seen and heard is, again, service providers have been very concerned about the well-being of their workforce, and have put in place a range of supports, both in terms of the practical aspects of keeping workers safe. And, you know, there was a big debate about, you know, when should PPE be available, and how should people be managing safe. There've been some jurisdictions that have been very clear and suspended all face-to-face contact and moved entirely to virtual, whereas others have created a more hybrid approach, but definitely with opportunities for safe and socially distanced connections, keeping it to a minimum, open air connections, particularly working together on the doorstep. And what we've also seen is an increase in connectivity between employers and workers. So, you know, daily check-ins, the introduction of higher levels of supervision. And certainly what we've seen is that both monitoring of data and also increased supervision has been shown to be absolutely key through this period, from a point of view of worker case management, but also personal well-being as well, and a recognition that that the workforce themselves have experienced their own stresses and strains. So some of the work that we've done on the impact of COVID on different demographics as they work remotely have been quite significantly, with definite evidence that people who are living on their own, or living in shared families outside their family, or who have primary aged and younger children, and who are having to homeschool, are suffering the greatest level of stress. And one child protection head of child protection that we spoke to said that they've actually moved to a workforce monitoring and contingency planning on the basis of which of their workforce have got family caring responsibilities on the top of a job, and understanding how they need to be flexible in order to manage those.
Great, thanks. I wonder, I've got a question for you, Vasanta, again. I'm actually wondering if you would like to speak from a data and intelligence perspective. And I know that the Evidence Centre has been doing a lot of work in this space. So I'm interested in your views on how jurisdictions, agencies and service providers can better use data and intelligence to support children and families, in this context.
Sure. So one of the things I just want to go back to actually is the previous question and how you support your workforce. So one of the things that we did kick off quite early was pulse surveys, and I think the value of that kind of rapid feedback from your staff about what they're seeing, what they're hearing, and what they need and how they can be better supported, and the ability to then respond quite quickly as an organisation to that rapid feedback was really, really important in supporting your workforce. So just as a side event, I think in terms of, from my perspective, I think what this tragic event has shown is actually the value of data, the value of research, the value of science, and the sort of the public understanding of the importance of that in terms of guiding decision making. So in many jurisdictions have demonstrated that, but in New Zealand we very rapidly set up rapid response and monitoring dashboards that enable the leadership team in our organisation to have a really real-time sense of what was going on in the organisation and what was going on in communities, and how we could respond to that quite quickly, I think was really important. And that is really maximising and utilising in real time your administrative data, and making the most of that to keep a check on things that are difficult to keep a check on otherwise, and that's really important. In terms of going forward, New Zealand has something called the Integrated Data Infrastructure, which is an amazing data infrastructure that enables us to model, not based on what we're seeing now, what we might see in the future, and how we can respond to that. And some of the work that we will be undertaking over the next while will involve, how we better support the recovery and how we model the impacts of some of the initiatives that might be put in place in terms of the impacts for children and families and whānau.
Thanks, Vasanta. We've got a couple of questions in now, one on mental health and one a really interesting observation about a national alert system. Cherie, in terms of the mental health of youth, this has definitely been a significant issue, and we know from the conversations that we've been having that most people are genuinely worried about this. And it goes to the theme we heard from the community of interest is we don't know yet what the true impact of extended lockdown and just simply growing up in a pandemic is going to be. For example, we've seen examples of whilst school attendance virtually has gone up, what we're also hearing from families is that, particularly for older teenagers, there's been a tendency to just stay in bed. We know that people who had mental health issues and young people who had some mental health issues pre-COVID and pre-lockdown. For some of those young people, these have been exacerbated by the situation. And what we're also seeing is, particularly because in some places in the world, and the lockdown experience has been very extended, 6 months or more, and that's long enough to be habit forming, so that we're seeing some increased tendencies in OCD behaviours, etc., and also kind of an anxiety around social contact, around being outside, about returning to learning as well as workplace from adults. So the mental health issues are to be yet fully understood, and it is a very stressful time. Here in Australia, there's been a lot of there's going to be a lot of investment in thinking specifically about this cohort, this generation of young people, and what responses need to be in place going forward to improve and shore up protective factors around these children and young people as they return to school, but also as the impacts of essentially a lost year are recovered. It's not all doom and gloom though, because we also have heard examples of stronger family connection, of families with new babies who have been able to have an unprecedented period of time at home, where if it's a two-parent family, actually both parents being at home to care for the child as well as juggling work, but this is definitely an area for future work, and we are genuinely worried about the number of young people who may leave school disconnected and who may not return to school ever. And then the question was just from somebody, thank you for this, which is about creating a national alert system so that when we're in lockdown situations, vulnerable people, children who are socially unsafe, suffering violence and abuse, can anonymously alert authorities to their needs. What could this look like, and how could we socialise this? There is already examples of this happening, in some jurisdictions, all families that were known to be vulnerable were so particularly young people were given a number that they could call, and also we saw examples of media campaigns alerting people to the availability of those options. But has it been done on a national basis? No, it's tended to be local, jurisdiction by jurisdiction basis. So so really interesting suggestion. I'd be interested in other people's observations and thoughts on that. Vasantha, have you got anything to respond there?
I'm afraid not, but worth exploring.
Yeah. So so a couple of questions here as well. Julia, yeah, this was a question from Julia, a couple of questions from Julia. Do we find that some young people are more responsive in working with professionals because it involves them in using their smartphones from a distance more than having personal contact? Absolutely, yes. And we heard some really good examples of how, particularly for young people, the use of smartphones has actually enhanced engagement rather than detracted from it. And it's also for those of you who are social workers or have had a past, you'll know that very often the drive in the car to family contact is often the case when the best conversation's happening, because you're sitting side by side having a conversation. And what we've seen is the equivalent of the phone becoming that. We've also seen some great examples of young people self-triaging using digital means, either online or smartphones. And what we also heard within the court system was that the virtual court was virtual court appearances for young people was really appreciated, because it was a time then they could see their and see their families or connect with their families, and that was a big gap for many young people who had to were living away from their family and weren't able to connect with them any other way other than remotely. Also, Julia, thank you for your observation about the bubble group. groups. I'd be interested for Santa because in New Zealand there has been work on initially in your initial phases of lockdown. There were the notion of bubbles and small communities of people who might come together.
Yeah, so in New Zealand, obviously, the notion of the bubble really took off, and who was in and out of your bubble, and I suppose that going forward is actually how do we use that notion to actually think about how we support communities in a broader context and young people in a broader context. But it's certainly something that has really I think the clarity of the notion, the non-judgmental aspects of the notion of, you know, who was in and out of your bubble was just really resonated and captured kind of what people needed to do and how they needed to kind of associate with people outside their bubble, and when they could do that, I think was a really important aspect of our managing through the first lockdown in particular, as well as the subsequent resurgence. And I think it was, yeah. So there is something for me about actually how do we continue to kind of build on that now that there is that familiarity, but actually how do we think about notions like, you know, safe bubbles, you know, beyond a pandemic context. So I think that's something to definitely build on.
I think as well, and this touches back on the point that Cherie was making earlier, that one of the things that we have seen an increase in terms of anxiety is an anxiety about people who are not in your local community bubble, in your family bubble, and so there is some discussions and concerns about maybe the long-term impact on the social development of children and young people who have been brought up and had a proportionately big chunk of their lives so far just restricted in their connections, and with some anecdotal examples of particularly younger children, maybe the kind of like the younger primary end, exhibiting signs of distress when they're expected to connect with, when they go back out into the world. So that'll be something that we need to keep an eye on, I think, going forward in the longer term.
I think that's right. In New Zealand, I suppose we've had the advantage where we were able to come out of lockdown faster.
Yeah.
And so some of those effects have been mitigated. But I think you mentioned earlier one of the effects is, you know, vulnerable youth and the disengagement from education, and that is something that we are definitely dealing with as a consequence. And the downstream, we don't know what the downstream impacts, but how you can re-engage those young people who may have been marginally disengaged before lockdown, and it just reinforced the disengagement is something we need to continue to work on.
I think just bringing in a broader impact there is because one of the things that we're definitely seeing and predicting is that the economic shock of the pandemic has been felt. So say, for example, in Australia, you know, 90% of businesses and organisations across the country have had to shift their ways of working in some way. So moving to remote working, but also what we've seen is, there's a whole tranche of businesses that have had to close and where families have experienced very significant increases in financial distress and that work opportunities. And so although in Australia, we're very fortunate that unemployment levels are relatively low compared to some other areas in the world, but nevertheless, unemployment rates have doubled. Just under doubled, and we're forecasting along what we're calling a sawtooth return, where there's going to be an extended period of quite economic bumpiness, with some businesses not being able to reopen, higher levels of unemployment, and also underemployment. So we see, and that creating some significant challenges for young people who might be looking to enter the workforce, and reduced opportunities as they're competing with older and more experienced workers. And interestingly, just in our budget this week, we've seen some significant investment in trying to maintain opportunities for continuation and encourage young people to stay in training and education for longer, as well as routeways and pathways, supported pathways into employment.
I maybe in some closing questions, and I'm interested in this one. I think what we've heard is a range of insights and innovations which came out through our research, but I'm probably interested just to wrap up in thinking about which ones we really felt were the most innovative and which ones were the most relevant for service providers thinking ahead. So maybe I might just start with that and then hand over to you, Sonia. And I think from my perspective, the innovation that stood out most for me was probably around the use of data and analytics in a way that drew on some more predictive measures to be able to identify future distress in families and hone in on those families that might result in more significant impacts on children and young people going forward. And that was something, I think, though, where in those particular locations they had the benefit of having put quite a bit of effort and cross agency collaboration and investment into that over a period of time, which then stood them in very good shape to do that during the pandemic, which was really quite remarkable. We did also, though, I think just in terms of the anecdotes that really stood out for me. There was something from the UK that was really just spoke to the way in which service providers had come together throughout this time and the local innovation that we had seen. And I think there was a thinking here that really local practitioners had really stood up to the kind of challenge that was before them, and had really, in the absence of if there was a lack of a particular consistent approach at that local level, they just went forward and did that themselves and put it in place in a way that was best suited to their local families and needs. And I think there was kind of a nice quote where really they saw that looking after children became a shared task, and there was much more role generosity among local stakeholders in coming together to respond to the needs of children and families during this time. So that's something that really stood out for me through our research. Sonia, what were your thoughts?
I think two from me really is one was that and I shouldn't have been surprised at this, having got children myself who easily operate 3 screens and at any one time, was the versatility with which young people themselves shifted to virtual methods for connecting with their social worker and the people who work with them regularly, and their willingness to embrace that and use it really well and wisely. Where I think when we were working with service providers, we heard a lot of concerns about what would this mean not to have this contact, but what we saw was, from a young person's perspective, there was a really easy transition. And also the potential of telecare, as with telehealth, and the openness of families as using that as a convenient means for connecting in a way that perhaps they wouldn't if it was they had to come out of their house and get to the Child and Family Services Centre for appointments. So some really interesting lessons learned learned there to shift. And then the other one was about the willingness of and the connection with the community and trusted people within the community, as well as the kind of the huge numbers of people who are willing to volunteer and connect on a local level to support their neighbours as they work through this pandemic, and the generosity of people. And then the final thing would be, which is the watch out, which is let's not forget about what's next and what might be beyond, and make sure that we're really understanding that. Santa, I'll hand over to you for the last word.
Sure. So in terms of some of the things that we saw here, I think the way that people adapted to using technology to continue the education, but then also some of the challenges around kind of like concerns from caregivers about actually how can they support children in their care to access this technology and to support them through the education, but the kind of continuing schooling remotely, access to schooling through the television medium, not just the remote medium, I think was something that had to be stood up quite quickly and fill the gap when schools were closed. So that was definitely a quick innovation, but something that will probably continue in some ways as we go forward. I think the other thing is probably not an innovation, but an interesting insight. Some of the things that we prepared for as we went into lockdown and some of the concerns that we had, we thought that we may see a lot of absconding and young people running away from their bubbles or from residences, issues around breaching of lockdown conditions. And ironically, we didn't see a lot. So it was amazing how people just got with the program, no matter what age they were and no matter what their situation was. So we were more prepared. We were prepared for the worst outcomes, but actually we didn't see a lot of that kind of behaviour during the lockdown, which was an interesting insight about that sort of community coming together and supported by, I suppose, clear governance and messaging.
Thank you so much. That's wonderful, and thank you everybody for taking part today. I think for Santa, I'm right that the research, the link to the paper has been posted to all of the participants.
Yes, absolutely. So there were a number of questions about access to the report and the slides. So I can confirm that the study is published on the Oranga Tamariki website and is accessible to everybody, and the actual recording of this webinar and the slides will also be available shortly. So, and just as a final note, I'd just like to again reinforce, one of the silver linings of this tragedy is the ability to learn across jurisdictions and from each other. And in that note, I really would like to thank you, Sonia and Georgina, for your presentation today. A lot of good work and thoughtful mahi has gone into this, and we really appreciate that. I'd also like to thank everybody that's come to listen to this webinar and your engagement and your questions. And so please do join our mailing list to keep in touch with future seminar events and to keep in touch with our research as we go forward. Kia ora tātou, and thank you and enjoy the rest of your day.